Nurses and caregivers with the California Nurses Association came together today to speak out against Palomar Health's waiver request, which would let the hospital increase the number of patients nurses can be assigned for a unit with mixed critical and intermediate care needs. The state has already approved the request, but it hasn't been implemented yet. Joanne Meza is a union representative for the California Nurses Association and also happens to work on the front lines fighting the COVID-19 pandemic as an ICU nurse at Palomar Health. She says implementing the changes would cause safety hazards.
Palomar claims that they took a hit due to the pandemic, but it's the nurses and caregivers who are taking the hit in the form of increased patient loads, unsafe staffing levels, and inadequate PPE, and struggling to fight back dangers of commingling of patients.
In response to the union's claims, Palomar Health CEO Diane Hansen said their organization has always provided safe medical care and would never put patients or staff at risk.
We do our best to cohort the COVID patients in one area and the non-COVID patients in another area. So there is absolutely no commingling of patients. We are doing, as we have from the onset of this pandemic back in March, we're doing absolutely everything we can to keep our patients, our staff, our physicians as safe as possible.
Hansen says the waiver only applies to a single unit at the Poway facility and would change the ratio from 2 patients per nurse to 3.
It does apply to only one 12-bed unit in our Poway facility. It will give us the ability to move patients out of the ED and into a nursing unit with both critical care level patients and then intermediate care patients.
Meza says the facility is already spread thin and the change would only increase the demand on an exhausted medical staff.
Do not take our ratios away. Give us more staff. Give us what we need. Give us our PPE, and please do not make us reuse our PPE. That's not what it's intended for.
Palomar Health says they are still trying to add more staff and have not yet implemented any of the changes granted by the waiver. Jacob Ayer, KPBS News.